So Health Now is a 4-year National Lottery Community Partnership funded project. Groundswell are the lead partner, and we work with Crisis in Birmingham and Newcastle and Shelter in Greater Manchester. The overall arching aim of Health Now is really about tackling health inequalities for people experiencing homelessness, really putting people with lived experience of homelessness at the heart of developing and delivering solutions to health inequalities.
And we do that on sort of an individual level through setting up peer advocacy services to support individuals to access healthcare in our areas, but then also at a systemic level to try and improve services for people who are homeless.
One day it could be taking somebody to a general GP's appointment. Another day it could be helping somebody, access drug and alcohol services, mental health services.
So we have Health Now alliances in each of our local areas. That's where we have our peers with lived experience who come together with local stakeholders.
We had people from housing and health, we had from day centres and other homeless organisations.
And also some specialist groups who work with specific groups of people, like people from the LGBTQI community or from asylum seekers groups.
And our alliance is tasked with developing an action plan to tackle issues that came out of our peer research into barriers to accessing healthcare for people who are homeless.
We then pass that information on to the system actors essentially and work out how we work together and collaborate to tackle health inequalities nationally for people experiencing homelessness.
So some of our volunteers are experts by experience and come to lend their ideas, their feedback and their own experiences. Or you can come in as a peer researcher, which means we will train you in how to carry out peer research. It's important that people with lived experience are involved in creating solutions because they know best what would have worked or what didn't work for them and what would work.
So people with lived experience of homelessness are involved throughout the research process. That's from the offset when they help to decide and prioritise the key research objectives.
It's given us the opportunity to talk to organisations and professionals that we would never have ever had the chance to talk to, and to give them an idea of what it's like from our side.
The confidence it's given me, the mental health satisfaction, just everything about it. It's just such an amazing project.
It's so rewarding knowing that you're helping to make a difference to other people's lives.
Health Now is important because it changes the focus of homelessness as not just being a lack of accommodation. We were really reaching out to people and trying to drag people along to listen to what our peers had to say. And after, almost 2 years of working, it's now completely reversed. We're constantly getting emails from people who want to come and meet our peers. They want to hear from them and they really value their opinion.
The more research that we do, the more information that we can gather, the more likely is we're going to affect change. We just have to keep at it and keep at it. And I'm just going to keep on banging that drum.